Good evening. My name is Irene Ringfield, and this is my elevator speech on the role of a nurse practitioner. The International Council of Nurses define nurse practitioners as registered nurses with, and I quote, the expert knowledge base, complete decision making skills, and clinical competencies for expanded practice, unquote. The American Association of Nurse Practitioners define nurse practitioners as independent healthcare clinicians who are trained and licensed to take care of patients by, and I quote, treating injuries and illnesses as well as supporting injury and disease prevention. A nurse practitioner conducts research, serves as a mentor, and lowers the cost of healthcare for patients by filling the shortage of healthcare providers that exists in this country. They work at diagnosing and treating illnesses while educating patients on disease prevention and health management. Because of the role and availability of nurse practitioners, patients who are marginalized, for example, those who are in geographic areas where they have no access to healthcare providers, those who are in health disparities, mental health disorders, chronic diseases, all have access to quality health care as at reasonable cost, and this is all because of the availability of nurse practitioners. While all nurse practitioners have nursing background, physician assistants could have a nursing background or any other basic health related background, just such as an athletic trainer or a medical assistant. They also work such as just like the nurse practitioner in diagnosing and treating diseases, and they are always working on teams with other physicians, surgeons, healthcare providers, and they also have master's degree just as the nurse practitioner. Then they are both considered mid-level healthcare providers. While the role of the nurse practitioners have been spelled out by internationally accredited organizations, there is no definition for the role of the PA that is internationally recognized. The PA always has to work under the supervision of a physician before they can practice. But the nurse practitioner, depending on which states she's practicing from, can be an autonomous healthcare provider. Like the nurse practitioner, physicians are also involved in direct patient care, but the major difference is their roles is that the physician can always prescribe medication, but with the nurse practitioner, she or he may not be able to prescribe medication depending on which state she's located and practicing. I I choose to become a nurse practitioner and not a physician, first of all, because of the time involved in the training. Whereas the nurse practitioner can start from the BSN level and use about 6 to 8 years to get a next master's degree or doctorate degree. The physician, on the other hand, takes about 10 to 14 years before he or she is a physician. taking into consideration the residencies and all that. And moreover, personally, I know nursing is the most trusted career in patient care. I would rather be a nurse practitioner with excellent bedside manners be a nurse with excellent bedside manners before becoming a nurse practitioner. And that would be a good wealth of experience with developing rapport and doing effective assessments with my patient than going straight to be a physician. That's my personal opinion. I'd rather be a nurse practitioner than a physician. Thank you.